case 3, a high school senior wide receiver in football caught a pass on the tip of his ring finger. Pain, PIP joint, x-rays were obtained. So what do we see, right? We see a fracture around the PIP joint. This injury pattern is often mistaken for a volar plate avulsion fracture. That's where the volar plate is, right? It's a thick ligament, and a little dorsally directed force pulls a little chunk of bone off the front of the middle phalanx. That's that little chip of bone there. Sorry it doesn't show up as well. The PIP joint should be perfectly congruent. So this is a normal PIP joint. So 2 perfectly concentric lines on a good lateral view. That's what you need to look for. With volar pilon fractures or fracture dislocations or subluxations of the PIP joint, you get a V sign, right? So you get a little V on the dorsal side where they're not perfectly congruent. So look for that V sign. And these can be subtle, right? The far left hand, no one's going to miss that. The one in the middle, probably not too many people are going to miss that. The one on the right, some people do miss. In fact, this was missed about 6 weeks ago, and because of persistent pain, the patient showed up to me. So we zoom in on this, and you can see that just doesn't look quite right. Gosh, is that a volar plate injury, an avulsion fracture? That little V sign is what the clue is, though. So this is the original case I showed you. This is that wide receiver. So we did an open volar approach to the finger, and we were able to get a closed reduction, and about 6 months later, a decent result. This is a much better than average result for this type of fracture. All right, so look for the V sign. If the volar fragment is less than 30% of the articular surface, it's usually stable. If it's more than 50%, it's unstable. Prompt referral is important, and don't send them for follow-up in 2 weeks. If you see any subluxation, follow up 1, 2, 3 days. We need to get to these quickly. They start to heal. Every day that goes by is a worse outcome. Their PIP joint's swollen. The articular cartilage is getting worse and worse. We try to get to these as quickly as we can. So unfortunately, a 2-week follow-up for these injuries is really common, and it's really doing the patient an injustice.